Hi, yes, it's Pauliano here from Tangmere Dental Care again near Chichester. Now, I've obviously realised that if we're going to be reducing fallow time, that we really need to see what aerosol is produced by actual dental equipment. I did do one video, and I'll put a link up there, which showed that without any mitigation, no open windows, no air filtration, nothing at all, that the aerosol produced by an air turbine was around about 45 minutes for it to settle down to normal levels. Now, we've got a lot of mitigating equipment now to try and reduce the fallow time. Obviously, there's still going to be a spray in the air, so of course it's still a case of wearing your PPE to protect yourself from potential infected aerosol. But the question is, how much of that aerosol actually goes into the surgery, how long does it actually take to settle, so that somebody, a new patient coming through the door, can actually safely come into the room and not potentially contract COVID. Now, there is a hierarchy of control. Of course, elimination, and we're doing that through our COVID screenings, where we're actually asking patients whether they might have COVID, and of course eliminating them by saying please don't come in, and then of course, you know, other things like which are controversial: temperature checks, doing mouth washes to reduce the potential viral load in the mouth. Some of those are sensible, some obviously are, you know, debatable. That said, if we know that we can actually eliminate aerosol here, and of course rubber dam, it goes a long way to eliminating the aerosol coming back from the saliva in the back of the throat. Then we've got things like the isolite system as well, that will do something very similar and allows you to work on a whole half of the mouth at a time, which I absolutely love. It's fabulous, the isolite. If you haven't seen it, I'll probably do a video on that as well, as I'm sort of getting into this. Anyway, the purpose of today's video is to use the air turbine using the DentalAIR, which was my winner in relation to practicality of use. You can easily move this in and out of the field of work. You can curl this up, so when the patient is sat there, I can sort of say, if you're going to cough or clear your throat, just do that against this shield here. And I'd have to say that even during examinations or non-AGPs, you can actually sort of almost visibly see the patient relax a little bit, because they realise that they're actually being taken care of. So what we want to do is to see how long aerosol takes to settle when we've got this in place. Of course, as Susie proved with the vape smoke, you can push the aerosol past the shield, but of course it's sucking in at a huge rate, and therefore, you know, it's really I saw one video where the smoke came out the side here and then it curled back in and went up the sucker. I mean, just so impressive. I tend to leave this running on low all the time, because that's filtering the air and actually purifying it. So I'm getting very, very low particulate readings in the room anyway, much lower than it was without any mitigating features. So anyway, I'll get kitted up and let's get on with taking some readings. Right, okay, so we're ready to go. I've got my PPE on, because I've actually got the model here, which is with some extracted teeth, and I decided the best sort of artificial biofilm was natural yogurt, teeming with bugs, and obviously is going to produce some particulates that are going to be measurable. When I did the particulate readings without any mitigation, I think the turbine generated up to about 300 sort of micrograms per meter cubed of particulates. So first, what we're going to do is to crank up the DentalAIR and bring that up to 100%, and we see about generating some aerosol. Readings are nice, they're well below normal values, so let's pick 2. Try and get it so you can actually see this. So we've got plenty of yogurt on there, and we're going to pop it in roughly position will be on the mouth. I'm going to take a time check, so 6:56 in the evening. Doing some overtime for you guys. If you like this content, I'm going to be doing a few others.
maybe on the isolite. So if you think this is useful, and then actually any members of the profession that might be involved with aerosol, some real scientists, not just a normal dentist like me, please put something in the comments. I'd like to know what your thoughts are. I'm going to ignore water coming out here. Well, actually, I don't want to get things wet. Let's just tip that away. And we would pause, wouldn't we, occasionally? Let the patient maybe have a break. Let's move some more yogurt down onto the tooth. Okay, we can see splatter on the inside of the aerosol. We're getting a lot of splatter here. Readings aren't really going up. And as you can see, I am destroying this tooth. Move a little bit of that there. Move this a little closer to the particular knee to see if I can get some readings here at all. Of course, please remember that this is without the nurse having a high volume suction. This is without rubber dam. This is without the isolite system. Looking very promising here, guys. I'm just going to keep this going. Okay, let's get rid of some water again. Bring this away almost from the operating field. We've got readings of over 300 without any mitigation on the other tester bit. Really trying, going for a while. Okay, well, I'm pulling this forwards a little bit. Sort of a little bit of an unrealistic circumstance here. Water dribbling everywhere, but I'm going to try and get something. Bring some more yogurt in there as well. Almost pulling the model away from away from under the aerosol. We are getting a few readings. A bit more yogurt in there. Okay, I've been going for a good few minutes. We've got a bit of a reading there, but of course this was trying to be exaggerated, not having the aerosol really sort of having this forward of the aerosol, so a fair distance away from the point of production. Don't know how fair that is, but as I said, I want to make this an extreme test for the DentalAIR. Nothing else is in effect at all, no open window, so hopefully if this shows a reasonable result, then maybe we don't have to freeze to death in the winter by pumping all that heated air outside. But there we go. Well, that's within a minute. And I'm splashing around in water, so we have plenty of aerosol here. Within a minute. The DentalAIR on its own has, and you can see the spray here, the DentalAIR has got the aerosol down to normal levels using the turbine, and I'll remind you, let's take this off. I'll remind you that without mitigation at all,
This was 45 minutes. It's 45 times faster to get the aerosol readings down to normal, and they're staying the same. I'm just going to, just as I've done in a few other tests, move. I did do a little bit of movement earlier, but I'm going to see if I can't get that to come back up, but that's dropped incredibly quickly. Now, this could well be a game changer. I mean, as I've shown you before in other videos, this is easy to position in and out. The filtration is lovely. It's metal box, it's not cardboard, as I've done in another test of another unit. Properly rated, compliant, reasonably quiet. I can't see what there isn't to like here, but just the reduction, the potential reduction here, if I can make this reproducible. I am going to be doing other tests with real aerosol, actually during a real procedure, but you know, this was an extreme test here, and yeah, well, as you can tell, I'm really excited. So please, 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 especially if you are actually in the know in relation to aerosols, because they do seem to be different, please comment. I would like to know your thoughts. If you're a general dentist and you think that this actually is a valid test that could be used to reduce fallow time, let's put this down. Trying to reduce fallow time, then you know, please put that in comments, because obviously it is all about peer review. If there is enough consensus of opinion, if enough dentists can actually do a similar test, you know, and all you need is a particulate meter. You don't have to be making videos like this. Measure it. Put something in the comments. Have you done a similar test? Because if this can be reproduced across a lot of different environments, we're looking at a very, very different workplace. Comment. I'm excited. Thank you very much for watching. See you later.